Welcome to Vaccine Watch Wednesday. Today I have my coworker, Katie Croson. She is a public health nurse and lactation specialist with me to talk about folks that are pregnant and breastfeeding because there's kind of a lot of questions about the vaccine in that category. So take it away, Katie.
So I want to start first by saying that pregnant and breastfeeding people were not included in the COVID-19 vaccine trials. So we don't have a lot of data regarding the effectiveness and infant protection. However, a well-known and respected peer-reviewed journal, the American Journal for Obstetrics and Gynecology, found that pregnant and lactating individuals had similar immune responses to the vaccines as non-pregnant people. And in this same study, antibodies from the vaccines were present in umbilical cord blood and the breast milk of vaccinated moms. So what this means is that vaccination during pregnancy and lactation can lead to immunity for both mom and baby.
That's really good news. Yeah.
Yeah.
So if someone is currently pregnant, is it a good idea for them to receive the vaccine?
Absolutely. So there is currently no evidence that antibodies formed from COVID-19 vaccination cause any problems with pregnancy, including placenta development. And based on how the mRNA vaccine works, experts believe that they're unlikely to pose a risk for people who are pregnant. And they've done studies in animals receiving the vaccine before and during pregnancy, and they found no safety concerns with that. Although the overall risk of severe illness is low, pregnant women are at an increased risk for severe illness from COVID-19 due to their immunosuppression during pregnancy as compared to people who are not pregnant. And as of April 19th, according to the vSafe After Vaccination Health Checker, the voluntary post-vaccine monitoring system that the CDC sends out, over 94,000 people reported that they were pregnant at the time of vaccination. So pregnant people should ultimately consult with their providers, of course, but based on this evidence, they may choose to be vaccinated when it is available to them.
Okay, good news. What about someone that's currently breastfeeding right now? Is the vaccine still safe for them to get as well?
Yes, so there is no evidence that the administration of the vaccine should stop because of lactation. The COVID-19 vaccine doesn't replicate, meaning it's able to create an immune response, like our bodies can create the immune response to the virus, but it doesn't reproduce inside host cells. And host cells are just your body's own cells.
Okay.
Because non-replicating vaccines pose no risk for lactating people or their infants, COVID-19 vaccines are also thought to not be a risk to the breastfeeding infant. Therefore, lactating people may choose to be vaccinated when it is available to them as well.
Good, good. So we've heard, there's been different myths and things that have gone around this whole time, right? And so that's one thing that's important to us here is that we talk to experts, we talk to a lactation specialist, we talk to somebody that's reviewed the journals and the data.
Every day.
Yes. So I mean, I've heard it circulating too about issues with infertility. So tell us about that with the vaccine.
So I can say I get asked this question, I would say almost on a daily basis.
Sure.
And there isn't currently any evidence that any vaccines, including the COVID-19 vaccine, cause fertility problems. So
Okay.
if you're trying to become pregnant now or want to get pregnant in the future, you may receive the COVID vaccine when one is available to you.
Good news. So this is really great news.
Absolutely. It's all good.
Yeah. Thanks for coming on and sharing this information.
Absolutely. Thanks for having me.